Do you have a painful bump on your eyelid? Is it red, swollen, and irritating every time when you blink? And what if I told you that if you're treating it in a wrong way, it could make it more worse? So stay with me till the end and I will let you know about the Stye, from causes to the treatment. Stye is also called the Hordeolum, the internal Hordeolum and the external Hordeolum. The internal Hordeolum involves the Meibomian gland and the external Hordeolum involves the lash follicles. So Stye is an acute, localized and painful bacterial infection, usually appearing as a red swollen lump on the eyelid margins, right, or inside the eyelid. And now let's discuss about the causes of the Stye or the Hordeolum. If you are having the poor eyelid hygiene, that can cause the Hordeolum, right? If you're touching your eyelid with the dirty hands, that can cause the Hordeolum, right? And if you're using the old and contaminated makeup or the contact lenses, that can also cause the Hordeolum or the Stye. And if you have a chronic blepharitis or you have a weak immune system, that can lead you towards the Stye or the Hordeolum. So as I said that the Stye or the Hordeolum is an acute bacterial infection. So what does it mean when I say the acute? Acute means it will come sudden, right? It will come overnight, right? It is not chronic. And what bacteria or which bacteria are involved? The Staphylococcus aureus or the Staphylococcus epidermidis. So these are the bacteria that can cause the Stye or the Hordeolum. Now the pathophysiology of the Hordeolum or the Stye. When the glands of the eyelid will blocked, the bacteria will start growing inside, right? And it will cause the infection. And infection will lead you towards the inflammation. And inflammation will lead you towards the pus formation. And the pus formation will lead you towards a red, swollen, painful bump on the eyelid, which is called the Stye. And now let's discuss about the complaints of the patient, the symptoms, right? If your patient complains about the pain, the burning sensation, or the foreign body sensations, or the watering, these are the initial symptoms or complaints of the patients in Stye or Hordeolum. And now the signs or the presentation of the patient in Stye or Hordeolum, right? So for example, if your patient is presenting a red swollen bump on the eyelid, a Stye. For example, if I touch that swollen bump and that is painful, that is called the tenderness, right? And if the eyelid is swelling as well and there is a pus formation inside that bump, these are the signs or the presentation of that Stye or the Hordeolum. Now the stages of the Stye. For example, the initial stage. The initial stage is, for example, if your patient is having the mild pain or mild redness and slight itching, that is initial stage of the Hordeolum. Now the second stage is called the progressive stage. If the pain is increasing, if the swelling is increasing and there is pus formation, a slight pus formation is there, this is called the mid stage or the progressive stage of the Stye. And in the final stage, if the pus is more and more and there is a rupture of the pus, that is called the final stage. And if you're having like a rupture and discharge with relief, that is called the final stage of the Stye. Now the home remedies. Home remedy is very important, resolving the Stye or the Hordeolum, right? And the first and the initial home remedy is a very important home remedy is your warm compression, right? Take a towel, a clean towel, put warm water on that towel and put that warm towel on your Hordeolum or Stye, right? For 10 to 15 minutes for 3 to 4 days at least. And the next is make your eyelid proper hygienic, right? And after that, if you're having Stye or Hordeolum, please do not use contaminated and old contact lenses, right? And do not use old and contaminated makeup as well. If there is no any improvement with the home remedies, then you can visit your doctor and he will prescribe you the topical antibiotics or eye ointment, the oral antibiotics, right, if needed. And after that, the analgesics, the pain relief, if you have pain as well, because this is tender. And if needed, he can do the incision or the drainage. Now, the important warning. If you are having Stye, please do not squeeze that Stye. It can make that infection more worse. If you find this video helpful for you, then do not forget to share this video with your colleagues.